So when one presents to a doctor, with some of these signs, what are some of the ways to check, that the blood clots are there? And also, let's also talk about the management.
Yes.
What are the options to ensure then that, the blood clot is arrested at a very early stage?
Good. So signs and symptoms, as I've mentioned before, are one of the ways that you can find out if you have a blood clot. But more importantly, to diagnose a blood clot, there are two tests. One is a blood test called D-dimer. This is a test that your doctor will order to see if you have blood clots or not. And if the test is positive, or if there's a very high risk or index of suspicion, then the doctor will do a test known as an ultrasound. This ultrasound test will image, it will actually visualize the blood clot in the vein and confirm if this blood clot is present or not. So the doctor now has done your signs and symptoms, they've ordered a blood test, and they've confirmed that now you have a blood clot in the leg. At that point, it's critical that they start treatment. And the treatment is blood thinners. The blood thinners now can be given by an injection, or you can take them by mouth. And they're very effective medications because they greatly reduce the risk of developing pulmonary embolism. So they'll treat the DVT, they'll prevent it from recurring, and greatly reduce the risk of this blood clot traveling from the leg all the way up to your lungs.
Okay. Let's talk about compression socks, which is one of the is a common thing that you see when someone has problems with their legs. Are they advisable?
Yeah, well, compression stocks, that's a good, an important point, because compression stockings, actually, that's the correct term, is graduated compression stockings. So what they are, they come in 3 different types, actually, and it depends on the type of pressure you want to put on the leg. So there's class 1, 2, and 3. Class 1 stockings are actually used to prevent blood clots from forming. Patients who are hospitalized, if you're engaging in long distance travel, maybe class 1 stockings are advised. Class 2 stockings are for those who have maybe severe varicose veins, have other conditions that promote more leg swelling. You do class 2. There are conditions where your lymphatics, which are your fluid drainage from your leg, is actually impaired, and class 3 or very tight stockings are used. Can also be used in the arm as well. But for this type of edema, we call it, or swelling, we call it lymph edema. Class 3 stockings are advised. So stockings, yes, are used, but they should be used for prevention and sometimes to treat certain conditions that lead to leg swelling.
All right. Let's talk about the prevention aspect of pulmonary embolism. And you did talk about lifestyle factors. So that then we do not get to that level, what are some of the lifestyle choices that we need to adopt?
I think even just a very important point, because we're seeing more and more young people actually now developing conditions that we thought were only happening to the old. So regular exercise is important. Reducing sedentary lifestyle, so being more active. We should probably be doing this interview while we are walking or standing. Yeah. And then weight reduction as well. So reducing obesity, improving your exercise levels are all tools, are all lifestyle interventions that one can do to help prevent the risk of blood clots. But what's probably more important now is actually blood clots in hospital. So 60% of hospital deaths occur because of what we think is related to blood clots.
Is it because of the inactivity while hospitalized?
Yes. So when you're hospitalized, 2 or 3 things occur. So first of all, you're sick. So you may be sick with a cancer or sick with some disease, or maybe you require surgery. So 1, you're already immobile. 2, the underlying condition that you may be admitted for can sometimes increase your risk of blood clots. And then 3rd, the doctor or the nurses have to give you medications, or even the stockings that you are referring to reduce the risk. So you can imagine in all these 3 things that they occur in a lady, for example, who's pregnant. Yeah. She comes into hospital. For 3 days, she's been in labor, not moving from her bed. She goes for surgery, a cesarean section. The cesarean section, afterwards, she's given medications. Of course, she's also in pain, so she's resting in bed. We do not sometimes give blood thinners because the patient has had surgery, and then she develops a blood clot. So the risk is being in hospital. 2, the condition she had, such as pregnancy, can predispose to this. And 3rd, she did not get the preventive treatment that is required.
All right, that's a good note to end at. And as we mark World Thrombosis Day this Sunday,
Yes.
I hope this is going to be, I hope this is going to be a take home for you and I to ensure that we prevent blood clots.